When someone is diagnosed with depression or any other mental illness and they're recommended to take medications to manage it, a lot of people feel uncomfortable with that. I hear it all the time when I talk to my clients about whether or not medication would be appropriate for them. I wanted to bust the stigma around medication, that medication changes who I am or I will get addicted to my medication. I just want to also clarify that I am not a doctor and I cannot prescribe these medications. I just know about these medications from working and doing medication management alongside doctors over time. My education around medications is very basic and general, and I'm going to share it in a very general fashion. Now, there are addictive medications you can take to manage anxiety. Those are called benzodiazepines, and examples of that are Xanax. They immediately stop a panic attack. They immediately stop anxiety in its tracks, which then make it addictive because you immediately get a good feeling when you're going through a bad feeling. Anything with an immediate reaction can cause addiction over time. But different medications that are prescribed for depression or anxiety, one category called SSRIs, or serotonin reuptake inhibitors, those are not addictive. They actually take 30 days to get in your system and to have an effectiveness to treating the anxiety or depression. So when a doctor prescribes you with one of these, they'll actually tell you, we won't know if this is working for 30 days. And how it works is it starts to change how the brain manages serotonin as well as other neurotransmitters in the brain and its production. Because remember, depression is medical. It is not a reaction to something sad in your life. It is not a weakness of you can't handle life. It is your brain not producing the hormones you need to function properly. Remember, the brain is an organ in your body just like any other. And if your pancreas wasn't producing insulin, causing you to have diabetes, you wouldn't think twice about taking insulin or taking any of the other medications for diabetes to help manage it. There's no stigma around that. But there is when we're involving the brain, because there's an association that I should be in control of all of my behavior. But the reality is our brain, there's a different parts of our brain that we don't have control over. Like whether or not we have our breathing rate. Our brain, if triggered with anxiety, will adjust our breathing rate to faster and shorter breaths. Now we can catch that and start to choose, okay, I want to start breathing slower. But we have to be insightful and intentional about making that choice and making that shift. But for example, we can't change how the brain affects our digestion. Those are different parts of our brain that control different parts of our body. So when we're diagnosed with something like bipolar, anxiety, or schizophrenia, we do need these medications to help our brain work the way it should. So SSRIs work by increasing the levels of serotonin in our brain, which gives us the everything's going to be okay feeling. Mood stabilizers are a different category. Those are the ones prescribed for schizophrenia or bipolar, and those help stabilize the mood or stabilize the energy, the actual electricity of the brain, as well as muting any extreme moods. This medication is very required with bipolar, or they will swing with a mania and depression, and those swings can be very debilitating. However, a lot of people complain about this medication because it can mute creativity as well. And there are a lot of very creative, artistic people with bipolar disorder. But again, this one is not addictive. This one, if you stopped taking it, you wouldn't have a relapse, you wouldn't have detox symptoms, and you don't crave taking this medication. We actually, on the other hand, have to really encourage people to keep taking this medication because some of the side effects are uncomfortable, but the side effects outweigh the benefit of not having those extreme swings of mania or depression. If you have more detailed and specific questions about medications and whether or not you should be on one, only a doctor can answer that for you. You can go to your OBGYN, you can go to your regular care doctor, or you can go to a psychiatrist. OBGYNs and family practitioners are usually happy to prescribe the basic SSRI anti-anxiety medication. But if you need anything more elaborate or any further evaluation, if you have bipolar or schizophrenia, you really do need to be in the care of a psychiatrist. What's the difference between a psychiatrist, a psychologist, and a counselor? I have that video right here because often people get those three mixed up. Psychiatrist does medication. Counselor, what I do, does the therapy while you are working on the symptomology of the illness, whether it's depression or anxiety, just for clarity. If you have any questions or concerns of someone has recommended that I should be on this medication, what does that mean? Leave a comment below, or if you're on one of these medications, share your experience if you feel comfortable to help others get the help they need and they deserve, because a lot of people are scared of these medications. Our hope is to really bust the stigma around getting help and living the life you deserve to live despite having these illnesses. Thank you so much for being a part of our community. If you found this video helpful, please like and subscribe so that it shares this with others so they can get the help as well. Look forward to seeing you in our next video.